So multiple sclerosis is an autoimmune disorder that affects patients' brain and spinal cord. We don't really fully understand why people get multiple sclerosis. There is about a 4% genetic link of developing multiple sclerosis, but about 96% of people, there is no genetic link for multiple sclerosis, and they just get it. So what multiple sclerosis is, and I tell people, and I use the analogy of like a copper wire, that there are nerves in the brain which are kind of like a copper wire. Then there's a covering around that nerve or the covering around the wire. And what happens with multiple sclerosis is that coating around the nerve or the coating around the copper wire gets stripped away for reasons that we can't fully understand. What happens is that myelin, or the covering around the nerves, makes the nerves travel really, really fast. And so with that myelin being taken off of those nerves, it causes the nerves to travel very slowly, and then it causes people to have neurological symptoms, including problems with their vision, speech, dizziness, weakness, numbness. They can have problems with their bowel or bladder. Fatigue is the #1 symptom that patients complain about with multiple sclerosis. It affects women more than men. It typically presents in women in their early 20s. So probably one of the more common symptoms as an initial symptom of MS is what's called optic neuritis, where the optic nerve is involved, where there is an area of demyelination along the optic nerve, and people will dramatically lose their vision. So normal vision is 20/20, so their vision can drop down to about 2400. They develop a lot of pain behind their eye. There's pain with movement of the eye, as well as sometimes they have difficulty seeing color. And that usually will prompt people either to come to the emergency room or will prompt people to come to their primary care physician oftentimes, and then they'll get referred to a neurologist. But other people can also present almost kind of like stroke-like symptoms, where they can wake up and have problems with the movement of their arm or coordination or numbness. They can wake up and maybe have numbness in their leg or anything new neurologically, dizziness. Symptoms of MS typically last for about at least 24 hours. So when people get diagnosed with MS, then the other question they always ask is am I going to get another symptom, or what do I know, or what do I expect? So I tell people that if they have a new neurological symptom that lasts at least 24 hours, that could be consistent with an MS relapse. But if people just have transient symptoms where they may have numbness in an arm or a leg that goes away after 5 or 10 minutes, that may not necessarily be related to their MS. There are different types of MS, and the different types of MS oftentimes will predict kind of the progression of their MS. So the most common type of MS is a disease called relapsing and remitting multiple sclerosis. And what that means is that people have relapses, or they'll have a symptom related to their MS, or there'll be a period where this myelin is taken off of the nerve, and then they have a remitting, meaning that the nerves start to heal themselves and they start to gain that neurological function back. And so a lot of times people, when they're first diagnosed, will be diagnosed with relapsing and remitting. About 66% of people, that's the type of MS they have, where they'll have these neurological symptoms that'll kind of come and go and come and go. Another type of MS is what's called primary progressive multiple sclerosis, where people are diagnosed with multiple sclerosis and then they never get better. So they may have a symptom of visual loss, and that vision never comes back. And then they may have a problem with weakness that never comes back. And so instead of this kind of up and down phenomenon that we see with the relapsing remitting, they get this phenomenon where they just kind of worsen over time, that gets worse and worse and worse. So diagnosing MS can sometimes be difficult. There's not a specific test that we use to diagnose MS, but it's a constellation of a patient's presenting physical examination, their history, as well as patients will have an MRI scan performed, and oftentimes will have a lumbar puncture. And based on the results of those studies, someone is diagnosed either with possible MS or definitive MS. There are a lot lot of medications that are available for MS. The first MS medication was released in 1992. Since that time, there are now 7 medications that are FDA approved for multiple sclerosis. So there's a lot of advancement in multiple sclerosis. There's also a lot of new medications that are coming down in the pipeline, and we expect some new medications to be released even later this year. What the medications do is that they help to slow down the rate of relapses or help to slow down the rate of disability associated with MS. There's no cure for MS, but being on medication helps patients manage their multiple sclerosis. It helps reduce them from having new neurological diseases. So it may not change their day-to-day lifestyle by being on treatment, but it may limit their need for further assistance down their life. It may help keep them out of a wheelchair for many more years or out of a nursing home as people get older in life. So that's the main goal of treatment, is to try to preserve their current neurological status. I always tell people, and people will ask me, well, what's my prognosis, or what should I expect 5 or 10 years down the road? And MS is very variable. So some patients can have more aggressive forms of MS. Some people can have a pretty mild course of their MS. I always tell people that I have 65-year-old women who still come walking into my clinic who have had a diagnosis of MS since their 30s. So there are people out there that do very well over the course of their lifetime. There's unfortunately people that haven't done as well, that have required additional assistance such as wheelchairs and such. But the main thing and the most important thing is to get on therapy as soon as you have a diagnosis of multiple sclerosis, because it is definitely shown to help preserve neurological function by being on treatments.